Is shaving your bikini line prior to your caesarean birth safe or not? Does it increase the chance of infection or not? Now, this is worth a watch and a save if you're having a caesarean. Now, when I recorded my previous video at the weekend, I'd said in the previous video that it's worth considering having a shave around your bikini line because when that wound dressing comes off, as it comes off, it can create a bit of a wax, which after a caesarean birth is kind of the last thing that you need. However, this comment made me go and explore the absolute rabbit hole that I've been down, and it's reminded me two things. One, that there is so much differing information out there that it's really hard to navigate as a pregnant woman. Everything that I have seen has had different information and advice that I've had to look at, but also two, to be up together with the evidence and information, but also to be able to unpick that evidence too. So let's look at the different information. So this one says not to shave in advance yourself, that actually your midwife should be doing it right before birth. This one says do not shave or wax your groin area as it increases the chance of infection. This one says that you can shave, but you must do it 3 days before the time of your surgery. This one says to use sterile hair clippers rather than a razor to remove any hair prior to the operation. Now that could be immediately before or in advance. This one says a few days before they will ask you not to shave or wax. So with so much differing information from all of the different patient information leaflets out there from different hospitals, what is the correct information and advice to give? And this is where I've been down a rabbit warren of trying to find out the information and evidence so that way you can make a really informed decision. So firstly, some of the evidence comes from like the 1970s, 80s and 90s, where we've got to consider what the actual type of razors which were available at the time were like. They were much more prone to cutting around the skin and actually increasing the chance of bacterial infection back then. Razors, as we know, have moved on since that time frame. Now, some of the evidence, if you have a look at the study design, you look at the actual methods, they've interviewed some people and implemented a no shaving educational program prior to the caesarean birth. And they've suggested that if you shave prior to the caesarean birth, you are much more prone to actually having increased infection after the caesarean birth. So the suggestion is that if you are to shave the day before your caesarean birth, if you do cut the skin, that can develop bacteria that when you do have an open incision for the caesarean birth, that bacteria can migrate from the cuts in the skin that you've used to actually cut the hair itself with a razor and actually go into the surgical incision itself, creating an increased chance of superficial wound infections. So this study concluded that by shaving the day before the caesarean birth, there was an increased chance of wound infection, and that when they did an educational program to try and reduce the amount of women shaving the day before, there was a decrease in the actual infections. However, if you actually go into their discussion, you'll note that actually there were many different things that were implemented in this time, including a change of the timing of antibiotics for the caesarean birth, different surgical scrub to be able to cleanse the area prior to the caesarean birth, and also implementation of the surgical safety checklist too. So whilst the authors concluded that it was due to women not shaving before birth, actually there were a lot more interventions that happened that probably had the biggest impact on reducing infections post-caesarean birth. So let's look at the Cochrane Library, which looks at all of the evidence and all of the information on this area. So the Cochrane collaboration has moderate certainty evidence, so it's not clear-cut at this stage because often these studies include too many variables, which includes shaving. And what they conclude is that by the woman shaving at home prior to the caesarean birth, it possibly increases the chance of infection. And it increases possibly an additional 17 more infections per 1,000 women in the razor group compared to no hair removal at all. Now, what they also find is that clipping hair has no impact on infection rates, so clipping would be a safer way to remove hair prior to your caesarean birth. Now, what the Cochrane collaboration also suggests is that actually shaving on the day of surgery, so by your midwives, for example, prior to actually going into the caesarean birth, might be safer. And this is probably due to the fact that if you have got any cuts from shaving your pubic area, actually the bacteria can grow over a number of days as opposed to a clean shaving around the actual wound site that is then going to be cleansed with chlorhexidine, for example, so there won't be bacterial growth. Therefore, it is safer probably to shave right before the caesarean birth as opposed to shaving the day before at home. Or as some of the other hospitals that have suggested at least 3 or 4 days prior to the caesarean birth to try and reduce the chance of infection. I hope that's clarified the safety of shaving and hair removal. Waxing, there is no evidence on whether it's safe or not, and it's taking that into consideration as well. And probably using the same rule of thumb that it should ideally be 3 days or more, potentially. We still need more evidence and research as to what the exact length of time is from a safety perspective and an infection reducing perspective. And I hope that there'll be more research studies in this area to clarify this. So to conclude, shaving at least 3 days prior to the caesarean birth, no sooner, or at the time of caesarean birth is the safest way to prevent infection when we are thinking about hair removal and caesareans.